Has stopped it. Yeah. Can it stop the video? Yes. Mensch.
Good morning and good afternoon to our friends in Europe. My name is Alina Polyakova. I'm President and CEO of the Center for European Policy Analysis in Washington, D.C. It's my pleasure to welcome all of you today to this panel discussion with our friends, the German Ambassador to the United States, Ambassador Emily Haber. Thank you so much for being with us today on this webinar. And of course, our friend, the Swedish Ambassador to the United States, Ambassador Karin Olofsdotter. Thank you so much, Ambassador, for joining us as well. This event is part of CEPA's effort to inform the general public and our audience about how various countries in Europe are responding to our common crisis, and especially how Europe is working together to respond to the COVID-19 pandemic that all of us as a set of like-minded democracies find ourselves in. For those of you tuning in on Zoom, there will be time for questions at the end. So I encourage our audience watching on Zoom to please write your questions in the Q&A. Use the Q&A function at the bottom of your screen. For many of you who are following along on Twitter or watching on YouTube, you can also tweet your questions in the thread on our Twitter page, and I'll try to pull in as many of your questions as I possibly can. And now let me open by welcoming the ambassadors here again. I hope both of you are doing well and staying healthy, that your friends and family in Europe are also well and healthy. And I know there's a lot to do. So for that reason, especially, thank you so much for this time you've given us. We have about 45 minutes for discussion today, which is not that much time. So let me just get right to our first question. Every country is taking a slightly different approach to mitigating the most immediate public health effects. The longer term economic implications are, of course, becoming increasingly more relevant as we see this public health crisis turning into an economic crisis as well. But let me start with the former, which is top of mind for everyone, the public health concerns. Ambassador Haber, let me just start with you. And there's been a lot of news from Germany over the last week, where Germany seems to be leading the way in mass testing and is slowly reopening the economic sectors based on a quite methodical and cautious model that the country has pursued. You know, how has the German approach evolved over time since the pandemic hit Europe and moved through Italy to the rest of the continent? And how would you say the country is doing right now?
You have pointed to the differences in approaches. But the truth is that many of the steps that Germany has taken are steps that other countries have taken as well. That is quarantine, that is social distancing, that is testing, that is rigorous contact tracing, that is hygiene, and so forth. Our numbers are quite high, as you know. We have over 150,000 infected. the doubling rate is over 66 days right now, but we are still at a new infection of 1%. That is, every new infected person will affect another one. We were already lower a couple of days ago or a week ago. It's probably due to slightly different behavioral patterns during Easter. Now, where's the difference? The differences are basically rooted in the structures and one head start that we had. Even before the WHO had concluded that transmission between humans was possible, a German scientist had developed a test, which then, when the WHO declared the pandemic, was quickly mass-produced and recognized. And as we have a very a federal and very intricate system of labs across Germany, we were able to do rigorous testing. We've probably tested more per capita than every country in the world. In addition to that, we did rigorous contact tracing. That is, we tested not only the person infected, but we tested everyone that was in contact with him. We have contact tracing teams in the health care authorities. We do it digitized. So we try to get as much transparency as we possibly could about the level of possible transition. Also, our healthcare system is well oiled, and we had a pandemic strategy in place which allowed us to take steps right after the pandemic was declared. We have doubled, no, not quite doubled. We had intensive, in our healthcare system, we have a very long tradition of intensive healthcare units. And it was at 28,000 in January. It's now at 40,000. So we really did that in a very short time, including the respiratory systems, which were 20,000 in January and now are at 30,000. So all of that allowed us to get the development under control, which is probably relevant for the very low death, not very low death rate, but the low death rate we have at. We have this, as of this morning, over 6,000 dead. And if you compare this number of deceased with the number of affected, you will see that it's lower than elsewhere, which probably is the case because of our healthcare system and because of our widespread healthcare infrastructure. Now, the second point is, it's true, very cautious decisions have been taken in order to reopen the society. We'll be taking step by step, because what we worry about is this pandemic is still in its beginnings. It will spread all across the world. It can come to revisit us. And what we don't want to set up is a landscape of interaction which is in place, which will simply be conducive to quick transmission should a second wave occur. And that's why we'll be taking step by step and evaluate at every step.
Thank you, Ambassador. Ambassador Olofsdotter, let me ask you basically the same question. How would you define Sweden's approach? Ambassador Haber talked about the commonality of some approaches that we've seen across Europe, as well as in the United States, in China, elsewhere. Sweden has pursued a more mixed approach, if you can call it that. How would you define that approach, and how do you see where Sweden is today in terms of a strategy to mitigate the immediate public health effects of the virus?
Well, thank you so much, Alina, and thank you so much for inviting to this very important seminar. And first of all, I would like, of course, to condole all the losses of lives. It's unbelievable, I think, what we are seeing around the world and in our countries, and people who are hurt, and our economies and so on. But of course, loss of life is awful. Well, we are many times perceived as having a laissez-faire or lax kind of strategy. That's not really true. We have exactly the same goals as everyone else, and that is to save as many lives as possible and also keep our healthcare system operating so that we don't get those kind of spikes that would make it impossible to treat everyone. So we have a long-term strategy. It basically hasn't changed. We are prepared to change it every day if we need to. So the difference, I think, what we have done is, first of all, you have to understand all countries are different, and we all take different measures depending on who we are. And in Sweden, we actually have a system that goes back 400 years with our great King Gustav II of Adolphus, who tried to take on Germany. It didn't really succeed. But anyway, we have a very small government with very big government agencies, expert agencies. And when we handle a crisis, we rely on these agencies. So that's the, how do you say, philosophy in Sweden, or the system of government. And it was early on decided that we should keep our schools open, not all schools, but from kindergarten or daycare centers up to 9th grade. Higher education like high school and universities are closed. Also, we are not allowed to visit our relatives who are in elderly care facilities. That's forbidden by law now. People over 70 are recommended to stay at home. Most of people work from home these days, just like here, but it's not like government mandated. It's a recommendation. And our society works with that people generally follow these recommendations. That's how it works. So, of course, the biggest issue we have, and which is awfully sad, is that the virus has gotten into our elderly care homes. Then you must also understand that in Sweden, you are put in an elderly care home when you are very, very, very old and very, very weak. So for instance, my own father, he's 90 years old. He has home care. But I think in many other places, maybe he would have been in an elderly care facility. So our people in our elderly care homes are usually very frail. So unfortunately, the big part of the losses we've seen to lives are in those homes, which is of course extremely tragic. It really is. So this is a long haul strategy. Right now we don't see any changes to it, but we keep restaurants open with social distancing. We also advise people not to travel within the country, and basically no travel abroad. So this is how it works. So it's just that we have a different way. Okay, we don't need to legislate. It's based on recommendations, some legislation. We also, just like Germany, have increased our intensive care units, doubled or tripled them. Still, and Stockholm is the most affected city, and there are still some capability or capacity in the IC units, but out in the country, there's lots of it, up to 60% of capacity. And Sweden is the size of California, but only 10 million people. So we live very, spread out, which means also that the virus hasn't really gotten hold. It is, of course, in the whole of the country, but at much, much less level than for instance, in Stockholm.
So I think you point to a couple of interesting factors that are perhaps helping Sweden manage the crisis in this measured approach that you described. One is, of course, the geography that you mentioned, but two that I think is quite important is the kind of societal cultural sense of individual responsibility and trust in government institutions, which Sweden historically has had very high trust in government institutions among the population. And that's certainly not the case in many other countries. And I think now we're seeing what the benefit of that is when individuals are obliging by recommendations without having to face fines or things of that nature, which has been the case in many other countries, including in some places in the United States as well. Let me ask you just a quick follow-up, and then I want to hear a little bit more from Ambassador Haber as well. Obviously, all of us in the US have been following very closely how the situation is developing across countries in Europe to see there's lessons learned. Now we're going through, I think, what could be called the next phase of this pandemic. As both of you said, this is a long haul. It's not that we're going to get over the hump and be free of this, that we're in this for quite some time. Recently, it was announced that Sweden might start to modify the strategy you described as weather's starting to get warmer, more people are gathering or will want to gather in large groups, is going to be the case in the United States, it'll be the case across Europe. What changes should we expect to see in Sweden that, and what will the impact of the policy shift might be over the next few months?
Well, thank you for that question. It's actually a misconception. It is not, so far, right now, the strategy is not changing. But as I said, our restaurants are still open. And of course, those of you who have been to Scandinavia know that we have extremely long, dark winters. And when the sun comes out in April, everyone basically wants to be outside. And we've had Easter, and now we have 1st of May, end of April weekend, which is a very, popular weekend to be out and about. So what we've seen in Stockholm is at a few restaurants, it's been too crowded. But there has been inspections and 5 restaurants has actually been closed because they did not adhere to the recommendations of social distancing. They have a chance if they can, show that they will to open up again. So this is a way of really signaling that this is serious. Yes, you can stay open, and of course that's great for the restaurants, and we of course don't want people to lose their jobs, etc. But you have to follow the recommendation, and that goes both for the owners of the restaurant and the people visiting them. And of course, we have seen that many younger people, when you're 20, you feel invisible, invincible, and of course go out, but maybe don't realize then what difficulty you put others in. So when the recommendations are not followed, there are strict, for these restaurants, very strict measures taken.
So Ambassador Haber, let me take you back over to you. As you said, and as Chancellor Merkel has also said in recent speeches, the numbers of those recovering from the virus is starting to outpace the number of infections in Germany, which is fantastic news. But in speeches last week, Chancellor Merkel said a few interesting things. I'd love to get your thoughts on her comments. Obviously, the Chancellor is very much enjoying high popularity for her, rational, calm response to the crisis. I think some of the highest approval ratings that we see in democracies, we see now for Chancellor Merkel in Germany. So she, in recent speeches, said 2 things, and I'll paraphrase here. She said in response to the good numbers that we've been seeing, the so-called good numbers in Germany, that this is still a very fragile moment, and that Germany is still very much on thin ice, and in fact, the thinnest ice ever. The other thing she said was about the nature of Germany's involvement at the European level and helping Europe and the EU especially manage the crisis. And one of the things she mentioned was that Germany would have to take a higher responsibility for managing the crisis at the EU level, which would include a much higher contributions to the EU budget. So can you tell us more what she meant about the country still being in very thin ice, but at the same time, how does Germany see its role in supporting EU solidarity during this crisis?
These are 2 different questions. Let me respond to the first. Why is this situation still fragile? Well, because there's still very many people who are infected, who potentially can be contagious, who can infect other people. So she explained to the German public to what extent the healthcare system and the hospitals would be overtaxed should the reproduction rate of the infection be under 1%, 1%, 1.2%. And these differences are huge. In one case, the hospital system would be overtaxed by October. Should it be at 1%, should it be over 1%, 1.2%? This could also already happen, given our high numbers, in early summer or before summer. So it's relevant what we're doing, and it's relevant whether we are taking things too far too quickly. And that's why she has advocated a very incremental approach and at every stage analyzing how this approach will translate into risks for the population and in particular for the most vulnerable of the population. So it's an incremental approach, reassessing at every stage what the impact will be. Your second question is very important, as the first one was, because at the early stages of the crisis, you could see that every country reacted in a manner that was rather inward-looking, taking care first of their own. Now, in this, I always hear people saying that this illness is, or the pandemic is unprecedented. And what is true about it is we've never had a worldwide pandemic where the knowledge about the pandemic was instant and happening at a very early stage. Usually after pandemics, knowledge was so scarce and fragmented, narratives would evolve over decades. But this is not the case here, and it's important because the early reactions seem to have determined the general outlook on how Europe fares in the crisis, which I think is not wrong, is wrong, because after these first fits of start, Europe has mustered a lot of solidarity in helping other medical systems, in helping patients, in helping in repatriation, and as you pointed out, also economically. There was the European support package that was to mitigate the impact of the crisis, which has been decided a couple of weeks ago, which included liquidity for those that were hit by the economic crisis, short-term wage short-term work schemes. It included liquidity by the EIB. And now we are discussing the future budgets, which will not be as we foresaw it in autumn last year. And we're discussing a new relief package right now, and we've thrown overboard many of the conditionalities, or actually practically all of the conditionalities, which have characterized earlier discussions on rescue packages during the financial crisis. So we are much more flexible, and we're really thinking big, because this is a double crisis, health crisis and economic crisis, but also potentially, if we don't act early on, a political crisis of the West.
Thank you, Ambassador Haber. You just put a lot on the table. I do want to address the economic dimension of this, which I mentioned in the beginning, you just spoke to quite directly. Last week, you alluded to this, there was another summit of EU leaders where a decision was made to approve around 540 billion euros for support to all EU member states around the crisis. That eventually the fund would be around 1 trillion euros committed to crisis management. Obviously, in the United States, we are going through repeated funding packages that are being funded by Congress. We just had a new one released this week to help small businesses. Ambassador Olofsdotter, since Sweden has traditionally been, for many years now, a country that many think of as quite well off, relatively lower inequality than many other countries, a country that has, as you described it, a quite well-developed social welfare system as well. What has the main economic effect been on Sweden especially? And I want to ask you to respond to the same question that I just asked Ambassador Haber to respond to. How does Sweden see its role in this moment of EU and European solidarity? What is Sweden's role here going forward?
Well, thank you. Well, our economy, just like everyone else, has really been hurt by this. And of course, it's the tourism industry, it's the retail industry, it's the hotel and restaurant industry, and so on, where people have, which has basically shut down. Even if restaurants are still open, but for hotels, etc., it's really a tragedy. So we expect that our GDP will diminish for 2020 between 4% and 8%. It's not really clear how much, but somewhere along that range. Unemployment has gone up. It's now latest figure was 8.1%. It used to be 6.5% before the crisis hit. So of course, in comparison to many other countries, it hasn't gone up that much, but it's still, of course, severe. So the government has taken several measures domestically to try to help out. There's big, debt loan packages for companies, for small and medium-sized companies. Taxes can be postponed. And so luckily, we have a very good debt situation in Sweden. Our national debt in comparison to GDP is about 38%. So we have room. It's been considered we have room to take these measures. We can afford them. Then it's of course always a matter of how you construct them. But there's been political unity in Sweden basically across the board on how to do this and how to try to save as many companies as possible and so on. So that's very important. When it comes to the EU question, yes, of course, we need to help each other. Absolutely. So we are in full support of jointly getting us out of this crisis. Our economies are interlinked. That's one of the main things with the European Union. We're one huge big market. We're all dependent on each other. I think lately, it's just been a discussion on how to do it. For instance, my country, together with some others, think that these kind of stimulus packages and so should be loans. Other thinks it should be bailouts. So there's a difference. I'm sure we will solve it. We always do. But as always, compromises have to be made. But it's very important that we have jointly decided on these kind of stimulus packages and these funds, because we really must get our economies going.
That's, I think, top of mind for many of us in the United States as well. We have quite a few questions coming in from our audience. If you are tuning in on Zoom, I would just encourage all of you to use the Q&A feature to send us your questions. Feel free to tweet at us at CEPA, that's CEPA, so we can include some of those questions. We'll try to get to, I already see some good ones that I'll bring into the conversation. But before I do that, I wanted to follow up on an interesting point on the political dimensions of this. Ambassador Haber started to point to. Of course, I think right now we're grappling with the idea that this initial public health crisis could lead to a much longer term economic recession. Some economists are predicting even something far worse at the global level. And how we all deal with that, of course, will, I think, to a great deal be determined to the extent to which we can support each other and work together. And I think that is especially true for Europe and the EU, but certainly true for our transatlantic relationship as well. We're all in this together, and to the extent to which we're able to work through this together, we'll come out of it better on the other side, whenever that may be. But on the political dimensions of this, I think this is an incredibly relevant question. One, for Germany in particular, because Germany is set to take over the presidency of the Council, the European Council, this June. And I'm sure now with the crisis that none of us predicted unfolding, your priorities are changing. So I'm curious to hear more, Ambassador Haber, what can you tell us about the priorities that Germany will have in this role come this summer?
We certainly had to redefine the priorities. And this process is still going on, but it's evident that our focus will be on the following issues. First of all, on managing the economic impact of the health crisis, on focusing on our capacity to stand our ground in crises such as these. It will be on innovation, technological independence in some areas where we have figured out that our dependence hampered our capacity to react in the crisis. It will be focused on climate change, obviously, because we believe this is a challenge that's not going to go away. And it will be focused on devising the next budget and the future financial developments in the European Union. So it's a tall order, but we're set to use the crisis as an engine for tackling those problems or challenges that have been a deficit or a problem during the crisis.
Thank you. I want to bring in a few questions that are coming in from those from our virtual audience tuning in. This one comes from our friend and colleague, Fran Burwell at the Atlantic Council. And she's asking about the status of border restrictions. And that is a question for both of you. What is the status of your borders? There has been talk of coordinated responses in the south of Europe to cope with traditional tourist travels. Germans and Swedes are big travelers to the south. What do you expect to happen this year? Ambassador Olofsdotter, let me start with you in that question.
Yes, we are big guests to our fantastic neighbors in the south. That's really, I think Swedes and I guess Germans as well are some of the biggest travelers in Europe. Well, so Sweden is, the Swedish government has told the general public to avoid trips abroad. And I think that deadline for that is now set to mid-May. So basically, there is no travel abroad from Sweden. The airplanes are down, the trains are not going, etc., etc. So people are really, staying at home. And there are many, I listen to the radio all the time from, various tourism regions that they've already seen bookings for, more Swedes coming, doing tourism in our own country. And I think that will be the case for many of us. Then I saw that there was, I think it was Mallorca today, who wanted German tourists to come because they had little spread of the virus. I think it was Mallorca, and as Germany is also doing fairly well. So we will see how it goes. Of course, it is important that we stay at home and we don't spread the virus. But then again, slowly, surely, we need to get back to our industry. But maybe we have to start in our vicinity and start with exploring our own hoods, so to speak. There are lots of Viking remnants you can go and visit in Sweden, also very interesting.
Which I hope one day when we're back to being able to travel across the Atlantic, I hope to visit. But Ambassador Haber, same question to you. How do you anticipate the reopening of borders to take shape, and what is the status of borders in Germany today?
Well, the borders are, we don't have cross-border travels right now. I don't foresee that to end anytime soon. This morning, the German foreign minister has said this will not be a normal summer travel season. It will affect all of us. It will certainly be an issue for the second half of this year when we take over the presidency, but I'll refer you back to what I said before. We'll take steps on the basis of evidence, and we don't define long-term objectives because we can't. We only know now what we know now, and it's not sufficient to predict decisions we might be taking in the future on the basis of evidence that has evolved by then. So we want to reopen the borders at some stage as early as we possibly can, but we can only do it responsibly, also taking into account the interest of all our neighbors, by the way, because if we are open, we cannot take the risk to take decisions that will affect our neighbors in ways they don't want to. So it's a very complicated, interconnected, highly interconnected process, but it will be very, very incremental.
So related to that, we have a question about other neighbors, for some outside the EU zone, from Odetta Barbalushi. Pardon if I butcher people's names here. She says, thank you for the very rich discussion. Do the EU member states, Germany and Sweden in particular, who've been strong supporters of EU accession and expansion, anticipate the inclusion of the Western Balkans into the relief package as part of the new MFF? And how do you envisage the inclusion to take place? And Ambassador Haber, let me start with you for that one.
I cannot really answer that, but what I know is we are aware that if we focus only on the relief within the European Union, we possibly exclude the fact that we'll need a lot of foreign assistance far beyond the European Union as well, because this pandemic has the potential to come and revisit us. So foreign assistance is not something that is necessary only for, say, moral or ethical reasons. It's necessary for national security reasons, and it's also necessary because of reasons of self-interest. What we do, or the lack of it, may come to revisit and haunt us.
Ambassador Olofsdotter, I think you're on mute.
Yeah. No, yeah, now you can hear me, right?
Yes. Did you want to answer?
Yes. No, I just want to echo what Ambassador Haber said. This is, of course, I also am not know the details regarding the Western Balkans, but we have clearly stated that we must really direct our foreign assistance to for all the reasons that Ambassador Haber said. Because of course, many countries are extremely vulnerable in this situation. They don't have the healthcare systems that we do. We also see actors that we don't want to see moving forward. So I think it's extremely important that the European Union and the United States work in harmony on this. It is really important that we put our efforts together and that we will also work within the multilateral organizations. The World Bank, the UN, the WHO, etc., so that we can strengthen our leverage. That's very, very important.
So let me stay with that theme for a second, because it goes to a few questions that have been coming in from the audience, from a couple of people, one from Terry Anderson, who's really asking about the role of Sweden and also Germany in leading not just on European solidarity and a broader European response, but on global response. We had a conversation with the Vice President of the Commission a few weeks ago, Commissioner Skinas, who talked about the EU's role at the G20 level in leading a coordinated global response to the crisis, which will stay with us, it sounds like, for quite some time. We may even see a resurgence of from the public health perspective in the fall, as some in the United States of the CDC and other health services have warned us. So Ambassador Olofsdotter, let me stay with you. How do you see the global response to this shaping, and what is Sweden's role in that global response?
Well, of course, we are just in the middle or in the beginning of this. I think this will be a crisis that plays out for a long time. I think it's extremely important that we don't go back to some kind of protectionist, isolationist reactions. For a country like mine, just to illustrate, 45% of our GDP comes from trade with others. All our companies are interlinked. Our economies are based on that we are interlinked. So let's just not throw that out because of the virus and because we are scared. We need to find ways to still operate the economy on a global level so that we all come out of this in a strengthened way. So that's one policy. And then, of course, when it comes to, there's also great risk of isolationism, I think, when it comes to security policy. And I think we need more cooperation than ever to try to happen or how to diminish those kind of gut reactions from many parts of the world. So a strengthened EU-US or transatlantic link is paramount, I think, for us going forward. Also having the discussions that you alluded to in the G20 and so on that we must continue keeping our economies open. That's paramount for going forward and coming back to where we were.
Thank you, Ambassador Olofsdotter. Ambassador Haber, to follow up on that, obviously all of these efforts are requiring a huge amount of financial resources from multilateral institutions and from national governments. Both Germany and Sweden, this is another question we have from the audience, have been net payers into the EU budget, unlike other countries that have been net receivers. And I think the question here is relevant is there going to be public support for expanding resources towards a broader European or multilateral response at a time when at the very local level, individuals are going to be feeling quite a lot of economic pain? Do you think that, I know this is a speculative question, But do you think that the governments will be okay with this? And do you think citizens will be okay with this?
Well, the Chancellor has already said, as the Finance Minister did, that Germany is ready to step up efforts because this is a crisis, probably the biggest crisis in the history of my country, at least since the Second World War. So that requires specific responses. And we have already placed a lot of distance between us and previous discussions we had on solidarity packages in the first decade of this century. So my answer to you is, we've stated publicly that we need to do much more. We have been ready to do things that were taboo before, like flexibilizing, more flexibility in dealing with the rules of the European solidarity mechanism, more flexibility with regard to the debt ceiling discussions. So the answer is yes. So far, the public, as you pointed out before, has rallied around the flag. The approval rates, not only of the Chancellor, but of the government in its entirety, are very strong, and they have not faltered once the direction became clear. We are still, I think, in terms of solidarity, the crisis has produced so much anxiety that a sense of urgency is simply there. This will still have difficult discussions on the stimulus package next year because of what my colleague from Sweden alluded to, and that is the issue of bonds and mutualization of debts, etc. These, from our point of view, will not help the discussions, especially given the fact that we've gone a long way to meet the needs. So my overall answer is yes. I think there will be support. There's a large sense of unity and unity of purpose. The approval rates are there, but again, we'll have to see. What will be relevant for the evolution of the discussion is how we actually fare with these steps we will have taken.
So we just have a few minutes left. So let me try to summarize a few questions. And Ambassador Olofsdotter, let me just go back to you. We started talking about the political effects this crisis might have. I know it's far too early to tell, but here in the United States, a question from our own Eleanor Anderson as well, that there's been a prediction by the US DC government, anyways, in Washington, that we're not going to see a reopening until the fall, and then we're not going to return to a so-called new normal until the spring, summer of 2021. I think that if that timeline rings potentially true to you, we have a lot of elections coming up across Europe during that time. Things will still continue to move forward, obviously, with the elections in the United States as well during that time. What are the potential political effects that you see of this crisis? I mean, one concern that many have had is whether crises tend to either bring Europe together or if they tend to drive Europe apart. What are your thoughts on that?
Well, of course, I share the view that this will, as you said, will be a long time till we're back to some kind of new normal. Well, when it comes to the European Union, as Ambassador Haber said, maybe we didn't start out that well because everyone was taken aback by the magnitude of this crisis. And of course, it's easy then to focus on your own. But we have seen that change, and there is absolutely EU solidarity right now. And when you think about this for a long time, we've been at the European Union for over 70 years. Of course, originally it is a peace project, and a peace project through economic integration. And for a country like mine, of course, there's very high support for our EU membership. I don't think anyone would like to roll this back because if we would, our markets would be very small, our economies would be extremely hurt. Look at us, 10 million people with an free market to, basically 500 million people. That's not something you turn your back on. And that's something you really try to make it work, because the alternative is so bad. So I am sure that we will come out of this, maybe in a different form, a different shape, with different priorities, but we will come out of it as a union, and because there's no alternative to it. And I think it's interesting to see also that the political parties in our countries that have been advocating, at least I think in both Sweden and Germany, that has been more skeptical towards the union, the more far right parties, they have actually, at least in my countries, the support for them has gone down, and the support for the kind of established or the middle of the road political parties and the government has really increased. And maybe this is typical for a time of crisis, and we will see what happens afterwards. But also, for the smaller countries in the European Union, a common foreign policy, of course, we are much more heard when we speak as one, even though, our foreign policy is sometimes criticized. Who can you call? Is there anyone who answers the phone? But at least there is a phone, and we do answer. So for us, this is also something that's important. And also, it's easy to just look at the big countries in Europe, but for the smaller ones, of course, we are much more powerful as a member of the European Union. So I don't worry about that too much. I think it will be bumpy, and there will be discussions like there is in any family when there is a crisis, and you react in different ways. But I'm not worried about us not coming out of this. It all depends on, also then we have to take in what the rest of the world looks like. And I cannot enough stress the importance of transatlantic cooperations in all areas going out of this.
Thank you, Ambassador Olofsdotter, for that note of optimism. I'm tempted to end on that, but I do want to give Ambassador Haber just an opportunity, just in 1 minute, to respond. Your thoughts. You brought up the notion that this is a potential political crisis for the democratic West, if I'm paraphrasing you correctly. How do you see this taking shape over the next year and a half? And do you share the optimism of Ambassador Olofsdotter as well?
What I meant was, and yes, I do share the optimism. I will explain why. What I meant was, we always say we're in this together. And of course, it's true, all countries are affected. But we do see that some countries use the crisis as an engine for division. We see the Russian playbook, and we see disinformation. We see the assertiveness of China in dealing with the crisis, in using our divisions, internal divisions, as tools in order to gain and extend influence. Are we sufficiently aware of this? Well, we should be, because if we want to use the crisis as an engine for more unity and for more political capacity to stand our ground, let's also be aware that there are actors out there that want to change the international geopolitical landscape, that focus on our internal divisions, that wish to enhance and grow them, and use that as for a change of the international, not only architecture, but also the international geography and landscape.
Thank you, Ambassador Haber. Thank you, Ambassador Olofsdotter. I think we could have this conversation for much longer. We try to keep these short and engaging for our virtual audience, but I would love to continue the conversation, to have you back to check in on how the crisis develops. As you said, that we're going to be in this for a long time. I think there are already lessons that we can learn from each other as we move forward, as we work together to try to mitigate the public health, economic, and then of course the political effects. And from all of us at CEPA, just thank you so much for taking this time. I know there's a lot on your plates, and I very much appreciate it. Thank you those in our audience for your excellent questions. I'm sorry I wasn't able to get to all of them. And in the meantime, please take care, stay well and healthy, and I wish you both all the best. Thank you.